Hello, welcome to another video. In this video I will read and try to understand articles written on the topic of psychiatry or psychology. Let's check some interesting topics. So in the previous video I mentioned this article, and let's check page 2. Epidemiology, prevention and assessment of. Let's check this article. It is published in this website. They have quite interesting domain, psychiatrist.com, and it is the journal of, obviously, peer-reviewed journal, the Journal of Clinical Psychiatry. Epidemiology, prevention and assessment of tardive dyskinesia and advances in treatment. Where is the article? Article still not started yet. Where is the abstract? Back to top. Maybe I'm missing something. So financial disclosure. I think it's not a good idea to start with financial disclosure because people want to read the article. They don't care. This is the beginning of the article. Tardive dyskinesia is a condition characterized by involuntary movements of the face, torso, extremities, and sometimes the respiratory system. It is usually observed in patients after long-term treatment with antipsychotic agents or drugs that have similar effects. This extreme pyramidal symptom was first described by Schoenecker in 1957, a few years after the first antipsychotic agents were used. While evidence suggests that patients being treated with second-generation antipsychotics have less risk for developing tardive dyskinesia than those treated with first-generation antipsychotics, the decreased risk is not as great as was originally expected because first-generation antipsychotics are still in use and second ones are being used for multiple illnesses. The potential development of tardive dyskinesia among patients taking antipsychotics needs to be monitored and, if it does occur, managed. Okay, so it seems general information. Epidemiology and prevention of tardive dyskinesia. Dr. Carroll discussed the clinical syndrome of TD, which consists of involuntary, repetitive movements that are mostly in the oral, lingual and buccal regions. Common movements are tongue protrusion, puckering, chewing, and grimacing. And you can check YouTube to observe tardive dyskinesia patients. I think there are other videos that show. Less commonly, abnormal involuntary movements occur in the hands, legs, feet, or torso. The condition can be severe and persistent and may have both medical and psychosocial consequences. Treatment with dopamine receptor blocking agents. So the author also meant this in the previous part, abstract part, such as antipsychotics increases the risk for TD. In many cases, once TD is established, it cannot be reversed. I'm not sure. I think it's potentially irreversible. I don't know about it. And it has been associated with poorer quality of life and increased mortality. The indications and off-label uses for dopamine antagonist antipsychotic medications have expanded over the last 2 decades, including not only psychotic disorders but also mood disorders such as bipolar disorder and unipolar disorder, depression, as well as anxiety and insomnia. Therefore, a larger number of patients are receiving antipsychotic medications than in the past. Dr. Carroll noted that the symptoms of TD are typically observed in patients who have received long-term treatment with antipsychotics, especially at higher doses associated with extrapyramidal symptoms, but TD may occur in untreated patients. So higher doses association is actually not really that clear, but it seems in clinical practices it seems to be clear, and sometimes they change first generation antipsychotics to second generation antipsychotics, and sometimes they even stop using antipsychotics, as I read in another article before. Similar movement disorders had been described in patients with schizophrenia prior to the existence of dopamine antagonist medications, which could indicate that schizophrenia itself may be associated with aberrations in the dopamine system that may give rise to abnormal involuntary movements in some patients. So it seems, it mentions the prevalence of tardive dyskinesia, and you can check this article by yourself to learn more about its detail and antipsychotic rating scales. I think rating TD must be not that easy. It's based on, as you see, at least mild involuntary movements in 2 or more body areas. So if you write a method part for your TD study, then you can mention this in your study. And so I'm trying to find the conclusion part, because I think that no one can stand hearing my voice more than 10 minutes. So I just want to finish it as soon as possible. Although the sometimes subtle and fluctuating symptoms of TD can be difficult to identify, Dr. Kane stated that clinicians can improve their recognition of this disorder through careful monitoring and consistent use of diagnostic criteria and rating scales. The Schuller-Kane criteria combined with a properly administered rating scale will enable clinicians to increase early recognition of TD, because if they don't properly apply scale to measure it, then they won't recognize it as a problem, and they cannot target it. And thanks for watching this video, and I hope you enjoy this and you will click my other videos as well. Have a good day.